everyone, welcome back to another video. In this video, guys, I am going to be talking about situational questions. I know a lot of people have been asking me about this because they are getting into interviews and they are given situations and they have never been, healthcare assistant, and they haven't encountered the situations before. So they've been coming to ask me, like, what would you do if somebody asks you, how would you act when a patient is aggressive to you? So those are situational questions. So firstly, I am going to explain to you guys, or to give a definition of a situational interview question. So a situational interview question is a question that relates to a situation. So employers actually want to see your skills in this question. They just don't want you to blob about. They actually want to see that you've got the good communication skills, you've got the patience, you've got empathy. So when you're answering your question, be ready to be putting all those skills in the question so that they're impressed. There is always different situations that happens when you're working in, a care setting. So this is why they want to know, like, what kind of a person you are, how can you work under pressure, how do you de-escalate a situation. Like if somebody starts, getting all crazy, are you gonna make the situation worse or better? So in order to tackle this kind of questions, guys, you need to use different methods. I know that there is so many methods that they teach. I remember when I was, studying about these like situation questions, they told us different methods or different techniques to use this. But the one that I really liked and that I feel like it's going to be helpful for you guys, it's called the STAR technique or STAR method. So I'm just going to explain to you what is a STAR method. So a STAR method starts with a situation. If you're asked a question, you have to start stating the situation. So S stands for the situation. And then we come to the T. And then the T stands for the task. The third one is action. And then after action, there comes the result. Sometimes they give you a scenario and you have to explain the scenario, like how you would have acted. Or sometimes they actually do not give you a scenario, but they ask you, like, tell us a time when you have to deal with an aggressive patient. So you have to state the situation, like how the situation was, and you follow it up with the task. What did you need to do? And then the action, what did you do? And then the result, what was the result? And sometimes with this kind of question, they follow up. So they give you this question, you've answered it, and you're thinking, yeah, I've answered the question, but they can follow it up and say, okay, what would you have done differently, or what do you think you achieved, or like how did that make you feel? So you have to be ready for that they might follow up with some questions. So in this video, guys, I am going to show you how you can answer these questions, giving you examples, a few examples, so that you know how to apply it when you're asked for them. So the first example that I'm going to give you guys is if you get asked a question like, can you tell us about an experience where you have to work under pressure? So with this kind of question, they haven't told you the situation, but it's you who has to mention the situation. So I would answer that question like so. One of the experiences that I remember working under pressure was when at one point I was working in a care home and we were understaffed by 2 members of staff, as they have called in sick with COVID. So that means we couldn't, give the patients medication on time, or we couldn't deliver their personal care on time. And we had one patient that was really agitated by it because the patient was used to routine and he wanted his things to be done on time and on his time, but then on this day we couldn't do it as we had other poorly patients. So the situation just started escalating as the patient started shouting and demanding that they get their care on that time. The situation is you've got an agitated patient who is aggressive, who is demanding his medication or he's demanding his personal care, and you don't have enough hands to actually deliver. So we move on to the task. So the task that we were meant to do was to give the medication to the patient or deliver personal care to the patient and make sure that the patient is comfortable and maintain their routine every day. That was the task that you were meant to do. And then we're going to move on to action. What did you do in that situation? How did you de-escalate the situation? Did you make the situation worse? Of course not. So what you want to try and explore in this one is you want to show like your skills, your communication skills, your patience, your compassion, everything that you have learned as a healthcare assistant or as a nurse, everything that just helps to calm down the patient. So what I would say is, firstly, I actually went to the patient and I explained the situation to the patient, that we were short-staffed because one of the members of staff were not there. This is me explaining the action that I've done. I will make sure that I'm maintaining eye contact. I'll make sure that I'm listening to him, and then I'm showing compassion to him. So the result, I would probably say, in the end, the patient ended up being calm, because the patient was being agitated and shouting because nobody explained to him why he wasn't getting his medication on time, or why he wasn't getting his personal care on time. So after I explained to the patient and I listened to him, he was able to de-escalate, and he even apologized that he was shouting because he didn't know what was happening. So the good communication skills and the listening has helped in this task. And before you go to interviews like this, make sure you've got scenarios that are in your head, because they can just throw something in and you can become blank. They are the hardest. But the good thing is, not all interviews are going to have it. And also, even if they're going to have it, not going to have like 10 questions that are situational. It can just come as just 1 or 2, just 3. Probably the most will be 3 situational questions. So just be ready for that, guys. Also, like I've mentioned, they could follow up situations like that with another question. So they could say, okay, tell us from that situation, what did you learn? So obviously, like I said, be ready. You can say, I've learned that sometimes we have to go to the patient and explain to them that, you know what, today we're going to be late with your medication because we're short-staffed, so that the patient doesn't kick off. Good communication skills are important in a care setting. People need to be alert. People need to feel involved. That's what I've learned from that situation. You could say that. So yeah, let's move on to the next. So another situational question would be like, tell us a time when you worked in a team. So in that type of a question, guys, what you must understand is they just want to know like your teamwork capabilities. Are you able to work in a teamwork? How good are you as a team player? So if we're going to be using the STAR technique or the STAR method, just know that you're going to start by mentioning the situation, and then you come with a task, you come with the action, and then lastly the result. So I would answer that question like, currently where I work, we are 4 in our team, and everyone is allocated where they're meant to do on a daily basis and how many patients they are meant to be looking after. But on one of these days when I was on the shift, 2 of the members could not come to work because they were feeling unwell. This means that we were understaffed and we had double the work. We have been joined. So from that question, the result would be everything was managed to be done on time, and it really helped us as a team to work together. It strengthened our team, and we realized that we are one team and we can help each other. This has made our relationship even more better at the workplace, just knowing that we can help each other. So to break it down for you guys, the situation is you actually saw that your colleague was struggling at work. That was the situation. So the task was actually to go and help them so that the load is better for them. They are not doing everything on their own. And then the action that you did is you actually offered your help. You worked together as a team throughout the day. And then the result was the work was manageable throughout the day. You managed to work together and the team was strengthened through that. So basically, that's it. The STAR, STAR. If that makes sense. So you guys, as you can see, this Baba is here with me, and I cannot keep or carry on with the video. I have to just see how she is doing. As you all know, guys, she had an operation, a surgery done. Her tonsils were removed and adenoids were removed, so she's a little bit feeling all type of ways. But I'm gonna give you one more question before I actually go, and I have managed to answer this actually in one of my interviews and I got the job. So I'm just gonna tell you guys how I answered the question. So it was like this: tell us a time when you performed an outstanding performance, when you performed in outstanding care. Yeah, I think that's how the question was structured. So I remember I told them of a story when I actually looked after a patient who was dying, a dying patient. So the situation was like the patient was dying and the family was around and they were really, upset and crying. And what I did, I managed to offer good care to the patient and also good care to the relative. So as you can tell, guys, the situation is like having to do with the patient who is dying, and then the relatives that are there as well, who are really upset and who probably have never gone through this before. So in my task, I want to make sure that I demonstrate how I have, given good care. So what I would say is that I went to the patient, I made sure that my patient was clean, made sure that my patient was comfortable, and most importantly, that my patient was not in pain. And I also went to the relatives and I offered them a cup of tea so that they can, you know, sit with their relative whilst their relative is going. I asked them if they've got any questions or if they've got any religious things that they want to do before their patient dies, like maybe call a priest. Are they Christians? Do they believe in anything? Is there anything that we can actually do to make... Apologies, guys. To be honest, I don't even know where we were. Being a mom, just being realistic, really. Trying to work, trying to do YouTube with the kids. Sometimes it's harder. Anyway, guys, I will see you again in my next video. Thank you for staying on this video. I apologize again for, you know, all this, but I'm a mom of 2 as most of you know, and sometimes these things happen. So see you again in my next video.